Hey everyone, welcome to another pre-op motor video. Today we're going to talk about the knee and the structures around the knee. The knee is a hinge joint, so it primarily flexes and extends, has a little bit of rotational property to it. If it was strictly just a flexion extension joint, it would be a little more fragile than it actually is. So let's get into it a little bit. So first off, we'll talk about the major bones. So we have the femur, the thigh bone. We talked about that in the hip video because it connects the hip and the knee, that big bone right there. And then we get down into our shin bone, which is our tibia, and then the smaller lower leg bone, which is our fibula. So the tib and the fib, those two bones in the lower leg, the tib is the primary weight-bearing bone in the shin, while the fib is pretty much non-weight bearing. You can break your fib and actually still walk, discomforting of course because there's a trauma, but it is not as weight bearing as the tib is. So I didn't connect the lower part to the ankle here, but if we're looking down at the ankle, these would also come together down at the bottom as well. So in the middle here, we have the kneecap or patella. It is kind of a, I like to say an egg shape in a way with a little bit of a flat top. That is a very important bone, and the reason why it's so important is because it actually attaches our quadricep muscles to our shin to aid in extension of the knee. So it has that leverage going over the top of the knee itself to be able to pull the shin upwards into extension. So very important, those four bones right there, but that's the only bones in that part of the body in the knee. So I drew some of the ligaments, the tendons, and also some of the cartilage around the knee, which a lot of people are going to be familiar with. If you've ever had a knee injury, the first thing we hear a lot about is meniscus. So the meniscus we have a medial on the inside and we have a lateral on the outside. So those are chunks of cartilage that sit kind of like a donut. They're kind of donut shaped in the knee, and they're actually padding so that this femur doesn't come slamming into the tib when it is going through its range of motion and flexion and extension, but also under impact, which for the sport of motocross, there's a ton of impact on the knees. So having your meniscus be healthy is very important. You can tear the meniscus and actually still go about pretty normal functions. Sometimes it can cause clicking because there'll be a little fray in there and that will start to rub, which isn't the best thing in the world. So it's always good to get that checked out if you're dealing with any sort of issues with the meniscus. There's two different types of meniscus surgeries if you do have an injured meniscus. One of them is a full-on repair where they actually go in and will suture up that tear and keep it together. And then there's another one when they go in and they actually remove the tear or the flake off to kind of re-smooth it out. One does take longer to recover. A full recovery for a repair can be longer than if you get a trimming, but you keep your cartilage. And as we know at this moment, we are unable to regenerate cartilage without intervention of other things. So we want to try and keep our cartilage as much as we can. Another really important cartilage to the knee is the articular cartilage, which I'm not able to draw on here, but on the femur, there is a smooth edge, and if it was just bone, bone's actually kind of gritty in a way. If you've ever had chicken and you've ate the bone or ate down to the bone, you can't feel the bone. It's not like super smooth. It's pretty smooth, but it's not super smooth. So we actually have a layer of articular cartilage that helps to smoothen out and reduce friction. There's also a good amount of it underneath the patella on the bottom side. So all that stuff is in there moving nicely. There's synovial fluid in there, which is basically the lubrication for the knee, so that's not creating a ton of friction and is able to slide nicely. So getting into ligaments, so real quick here, ligaments attach bone to bone while tendons attach muscle to bone. So common tendon that we hear is the Achilles tendon, which is actually attaching the gastrocnemius muscle of the calf to the heel or a calcaneus. That's a very big one, but right here we also have our Patella Tendon, which attaches everything of the quadricep muscles here down into the patella through actually the quadricep tendon here, which attaches on the proximal side of the patella, and then into the kneecap, and then we have the patella tendon, which attaches the kneecap to the shin. So we have this anchor system going on so that when the quadriceps are working, they are able to fire, hinge over the top with a pulley system, essentially, because it has that anchor with the kneecap, which we don't have an elbow cap, so it is a little bit different than the elbow in that way, but it has a lot of force generation because of that leverage. So a lot of physics at work with that. Getting into that. I drew the medial side here because I wanted to put a little emphasis. Typically tendons are going to be white, they're not going to be red, but white's not going to show up on a whiteboard. So we got a tendon coming in on the medial side here, which is actually going to be the sartorius muscle, which is a part of the thigh here. It's going to come across. And the reason why I wanted to represent that one is because on the outside here, we have the IT band, which is a really big band of fascia coming off the tensor fascia lata of the hip and actually attaching those muscles of the hip to the knee, so the knee can have control internally, externally, through adduction and abduction as well. So there needs to be some sort of attachment up here, which is through those two big muscles, which that's why I wanted to draw those tendons there and show the representation on the side, not just the quadriceps coming down and attaching into the kneecap. Otherwise, that's not going to be actually a very stable joint if it only has muscles on the front and only has muscles on the back. So on the inside here, we also have our adductors coming in, but our adductors, the brevis, the magnus, and the longus actually attach into the femur itself. The Gracilius is a muscle coming off the pubis and attaching into the inside of the knee. That also helps stabilize the knee. And then our quad muscles, the vastus lateralis, vastus intermedius, vastus lateralis, and then the rectus femoris, which are our 4 quadricep muscles that come down and attach into that patella. Now, moving into the back side of the leg, this is just the front here. We can turn it around and we'll have our hamstring complex back there coming down, our semitendinosus, semimembranosus, the bicep femoris coming down and being the antagonist to the agonist in the front. So these two muscles are opposing. So when the hamstring is in flexion, the quad is in elongated state, and when the quad is in flexion, the hamstring's in elongated state. So those two muscles are playing a little bit of tug of war, but more like a teeter-totter rather than tug of war, I should say. Getting into some really important structures of the knee and why this is very important pertaining to the sport of motocross is because we have those ligaments around the knee. On the inside, we have the MCL, which is the medial collateral ligament, LCL, which is the lateral collateral ligament, PCL, posterior collateral ligament, and ACL, anterior collateral ligament. So ACL and the PCL actually sit on the inside of the knee, and they crisscross each other in a way that helps to keep the shin from slipping forward and also backwards, which they do a great job of doing. So that shin we don't see very often actually leaving forward in a dislocation. It can happen, of course, and we don't see it leaving backwards in dislocation too often. So a lot of times when people tear their ACL, it's due to a bit of a flexion and a twist. So for moto, we could think about catching the foot in a rut and it twisting in a little bit of a bent state and it goes out, which also tends to lead to an ACL with an MCL tear. A lot of time when the MCL also tears, it will grind and tear that medial meniscus too. So we really have quite a conundrum when we catch a foot in a rut in that knee twist and tucks behind. So we could have an ACL, an MCL, and also a meniscus tear, which is a very big recovery to come back from, but absolutely doable. Recovery is getting a lot better. But we're here to talk about prehab rather than rehab, of course. So the structures around the knee here, you can see how important they are. If we go to the bottom, we have the calf muscles, as we would call them, which is going to exist of our gastrocnemius, our soleus. Then we also actually have a posterior tibialis, anterior tibialis, which is going to come on the front side. Then we go to extensor digitorum, which is also another shin muscle, because these muscles are going to actually aid in ankle flexion and ankle extension, but they're coming off of the knee, so they do play part of the knee. A really important muscle is called the popliteal. So, or popliteal is a left to right. So on the back side, it's gonna run left to right rather than up and down like all these muscles, right? Quads running up and down, shin muscles, calf muscles, hamstrings, everything's vertical. This is actually a horizontal muscle. And what it does is it's an anti-rotation muscle for the knee, because the knee actually has the ability to rotate ever so slightly. We can see that actually if we were to take like a curtsy, which we'll have some curtsy lunges in the next video, and you'll be able to see how that knee is actually capable of rotation. But that popliteal muscle is going to help anti-rotate. If you catch a knee, and no matter what the sport is, it's gonna actually be a decelerator of rotation rather than a creator of rotation. And that can help to potentially save the structures and the ligaments and stuff inside the knee, being that ACL, and potentially things like the MCL, LCL, and the meniscus as well. So pretty complex little piece here. The muscles don't change too much from the hip, other than we just introduced a little bit of those shin muscles, which we'll go over the shin muscles again once we get down into the more distal ankle and foot. But we're gonna break this out, and then we're gonna look at 5 different exercises that we can do to help improve the strength around the knee and also the mobility of the knee.